CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello, and welcome back to another episode from our new season of CYC MD. Previously, if you recall, we met with different healthcare professionals and providers, all of whom gave insights into their careers as well as education and schooling. In this new and exciting season, we are indulging and digging deeper with our professionals and our doctors in regards to their focused area of expertise. With me today, I'd like to welcome Dr. Heidi, who is an ENT specialist at North Shore Hospital in LIJ and also associate professor at Hofstra University. Have you? So first, I actually just want to say congratulations from when we last met. And you're a mom, second time around, if that's what they say. Your second baby, congratulations. And now I know you have a really busy schedule with 2 babies, being a mother, being a wife, and also time for work, and of course time for service. So I know your schedule is really busy, and I just want to thank you, and I pray that God blesses your time and reward you for all your efforts.
Thank you, and thank you for having me.
So last time we met, we touched over the topic of the nose, and we said when you have a nosebleed, correct me if I'm wrong, so I just want to remind our viewers, we said if there's a nosebleed, the first thing we want to do is remain calm, and we put our head forward, and we gently pinch our nose, and about maybe 10 to 15 minutes, if so, the bleeding should stop. If not, we seek medical attention or medical help. Okay, good. And then we also touched on the topic of sinuses.
Yes.
Now, I just want to revisit that topic because I know that's also very focused and a lot of people have questions on the sinuses. So what are sinuses and where are they located?
Sure. Actually, chronic sinusitis is the most common chronic disease reported in the U.S. It affects about 12.6% of the U.S. population. And basically what the sinuses are holes in your head, okay? Basically, they're air-filled pockets. These are called the frontal sinuses. These are called the maxillary sinuses. I'm going to flip this towards the back to show you the ethmoid and sphenoid sinuses. So they're a bunch of air-filled cavities, and they're lined with a special skin called mucosa that produces mucus. The function of the sinuses, people debate, are several-fold. One, it's so our head is not so heavy, right? Otherwise, it would be dense bone throughout. The second is it resonates sound, so it can affect your voice. Third, the whole purpose of the nose is to humidify and purify the air that's going to eventually end up in your lungs. So these sinuses have almost like a filtration system to purify the air that we're inhaling before it hits the lungs, at least partially. And it also humidifies the air.
Wow.
So those are what our sinuses are.
So what is the term sinusitis?
Sinusitis refers to any inflammation of these air-filled cavities, okay? Not necessarily of the nasal cavity, but more specifically to the sinus cavities. That can be from multiple sources, okay? When people refer to sinusitis in general, it tends to refer to the infectious causes of it. However, there's allergic sinusitis and other forms of sinusitis as well.
So what are signs and symptoms of this sinusitis? If somebody were to experience it and come into your office and tell you, they'll have this, and then you tell them, well, you have sinusitis.
Sure. Well, the more common things that we see in the office are facial pain, congestion with pussy drainage from the nose, which is usually either yellow or green in color, not clear or watery, fatigue, fever, Also, you can have pain in the upper teeth and bad breath. That's what we think of when we have acute sinusitis. There are some unlucky people who have chronic sinusitis, which tend to have these symptoms more or less for 3 months or more. An acute episode of sinusitis is usually limited to less than 2 weeks. Okay, and then there's that area between 2 weeks and 12 weeks, which we call a subacute sinusitis. So most of the time people will have acute sinusitis, but there are unlucky people who will have these annoying symptoms for prolonged periods of time.
So what measures can be taken for someone to treat this sinus reaction, or, well, would you call it a reaction or?
Infection.
Infection. What measures can they take at home, or just simple things that they can do as a treatment to themselves?
So the main question is, do I have just a simple cold, or do I have something that needs antibiotics, right? So usually we try and flesh that out when we meet with patients. Firstly, have your symptoms been going on for more than a week? In which case it's more likely you're going to need antibiotics. The symptoms that I mentioned before with the pussy drainage and the facial pain, etc., those also can tend to require antibiotics. In terms of home treatment, usually in a combination with antibiotics, if they're necessary, you want to use topical or oral decongestants and saline rinsing, because the idea is you want to open up the tract to drain all of the infection or mucus that's being produced. That'll at least help you feel better. However, just a note that the decongestants that you use over the counter should not be used for a prolonged period. I usually say 5-day maximum, because you can have side effects that are not too pleasant with them if you use them for longer. Also, you want to be cautious if you have high blood pressure or a propensity towards palpitations, as the over-the-counter medications can exacerbate some of those problems.
So what are some examples of something that's maybe like an over-the-counter product that can relieve this sinus pressure?
Sure. So common things that you'll see over the counter are these nasal sprays, right? And this has oxymetazoline in it, which is a more common over-the-counter decongestant. It's also called Afrin. You could also use things by mouth like Sudafed, Advil, cold and sinus, Dayquil. They all have decongestant in them. Okay, and like I said, these work great for the acute process, but I would not recommend using them for prolonged periods of time. They're not safe for that.
Mm-hmm. So if I'm at a drugstore and I'm on the aisle, what main ingredients would you say I would want to?
If you're going to use any decongestant, you want something with, if it's topical, oxymetazoline is the most popular one. Phenylephrine or pseudoephedrine are also oral forms of decongestants that you can use and look for.
So for patients that are more chronically, and they've tried all these over-the-counter products, they've tried certain antibiotics, and it still hasn't relieved this sinus problem for them, when would you say a sinus procedure or surgical procedure would be necessary?
So nobody likes the word surgery, unless we absolutely have to. So there's kind of a maximum medical course that should be tried before kind of moving towards that option. Firstly, you want to try a prolonged course of antibiotics. Most of your courses for acute sinusitis are anywhere between 5 and 14 days. For chronic sinusitis, you can try something as long as 21 days of oral antibiotics before you move to the operating room. Also, you want to try nasal anti-inflammatories, rinses, and you want to make sure that there's no allergy component, because if you don't treat the allergy component, you still might not get the optimal effect of the medical treatment. Once you've kind of exhausted all of that, your specialist will probably recommend a CT scan to evaluate the anatomy of the sinuses and see if you're a surgical candidate. So when we talk about sinus surgery now, there's now minimally invasive techniques, and then there's things that have to be done under general anesthesia. Depending on where you fit kind of in the spectrum, there are minimally invasive procedures that can be done in the office. One of the newer things that we have is called balloon sinuplasty. And our friends from the company at Clarence kind of did us a favor and lent us a device. So basically, this is like angioplasty for the nose. You're numbed up locally in the office, and under the guide of a light, This is slipped into the sinus opening. Once we've confirmed we're in there, we go in with a balloon and we inflate this balloon to widen the sinus outflow tracts. You go home the same day and it's minimal recovery. But not everybody's a candidate for that. If you have, more involved sinus disease, or if you have polyps, you might need formal sinus surgery where you go to the operating room. And, we do something similar, but with a greater combination of devices, as well as working on more of the sinuses. So that's kind of what sinus surgery entails.
So regarding, we touched over sinuses, but how would I know or not be confused with the fact if I have a sinus problem, an allergy problem, or just a regular cold problem?
So let's first talk about a cold.
Okay.
A cold usually involves, some of the symptoms we talked about, such as nasal congestion, clear drainage, but it doesn't have severe fatigue or pussy drainage, and usually it's less than 7 days in duration.
So you recover
more quickly. Once you're past the 7-day mark, the studies have shown that your chance of recovery without antibiotic treatment is way down. So that's one good gauge. When we talk about allergies versus a sinus infection, the sinus infection has some of the symptoms we talked about previously. Allergies tend to fall under a different category. The drainage tends to be clear and watery. You tend to have itching, sneezing. You might have eye symptoms such as, tearing or itchy eyes, or a little bit of redness in the whites of your eyes. And sneezing tends to be a bigger symptom with allergies as well. Also, allergies tend to peak in your 20s and 30s, but you can have them in the pediatric population, and they can extend when you're older. But 20s and 30s tends to be the peak of it. And a lot of people have this misconception that allergies are only occurring in the spring or summer when we think of tree and grass pollens. But there are allergies that occur year-round. If you're allergic to dust or mold, or cats and dogs, those are all year-round allergens that you can be exposed to. So once your doctor meets with you and kind of fleshes out the history of your symptoms, they might have a suspicion of allergies, and when they examine you, they might also see signs that you may have allergies, and consider allergy testing to kind of make the definitive diagnosis of whether there's an allergy component or not, because sometimes they can occur simultaneously as well.
So we're going to actually just stop for a short break, and we'll be right back with more questions and answers in regards to allergies, nasal endoscopies, and much more in regards to problems and issues about your nose. We'll be right back after a short break. Welcome back. We are back with Dr. Heidi Marzouk in our talk about your nose. So, what tests can be done to detect if a person has allergies?
So there are multiple methods to test for allergies. One is through blood work with something called RAST testing. And then there's a couple of modes of skin testing. We used to do scratch testing in the past, but it's no longer been shown to be accurate. So the two main forms that you might see in a doctor's office is something called prick testing, and the other called intradermal testing. Intradermal testing is where you're given shots of different allergens, either in the arm, in the back, etc., and they measure kind of the reaction you have to them, it can be a little bit cumbersome. However, prick testing is kind of the new mode of how we test, which is a little bit more efficient. Basically, what we do is either on the arms, maybe in children on the back, we use this device and we basically put different allergens on the prongs and roll them against the arm, okay? We wait approximately anywhere between 10 to 20 minutes, and we measure the different reactions you have to the allergens. And you'll see what's called a little welt, called a wheal, and some redness around it called a flare. And depending on how you react compared to histamine and something more benign, we can determine whether or not you have an allergy and potentially how severe the allergy is. There's another method called patch testing, but that's more common, not for necessarily problems with allergies in the nose, but more for allergies and skin problems.
Wow. So even at a young age, you would even do that for even little
children?
in children as well?
So for the pediatric population, especially those under 3, we tend to see more of a problem with food allergies, which can be tested in a similar method. So kids with, chronic eczema, problems with the nose as well, they can react to foods by having nasal congestion and things like that. Kids with actually chronic fluid in the ears, when they're above age 3, about 40% of them will also have some environmental allergies. Kids who are asthmatic also have a very common propensity for allergies. So when we see this picture, we tend to think of allergy kind of in the back of our minds and consider testing it. This prick testing that I just showed you is a very valid way to test for children. Like I said, we usually use the back. It's not too painful. The kids usually tolerate it very well, and you can kind of know almost on the spot what allergies you have. If you feel the kid won't tolerate it or there's other medical factors that preclude you from doing prick testing, you can always obtain allergy testing via blood work through the RAS testing I mentioned earlier.
So just to give a scenario, if a child actually were to you and maybe the mother suspects that they have, I know this is kind of popular, like a peanut. So in that case, and she tells you she suspects it.
Yes.
He had this, he ate, she'll tell you he had a peanut butter sandwich and he ate it and, developed this reaction.
Yes.
In that case, what would you do right away?
So after taking more of a thorough history, I would examine the child just for general symptoms or signs of allergy on physical exam, because a kid can't really tell you their symptoms too much. So there are certain physical signs that are more common in children that we look for. And then in the office setting, I can test them for the peanut allergy right there. Not only to peanuts, pecans, pistachios. We can test for a whole array of different food allergens. And within, like I said, the 10 to 15 minute mark, I just measure the wheals on the back or the arm, and I can tell mom if there is truly an allergy to that food. And really the main treatment for food allergies is avoidance at this point. We really don't desensitize kids very often for foods. It's mostly avoidance strategies.
Mm-hmm. So shifting gears back to allergies related to environment, with whether it's pollen, the trees, the grass, different seasonal changes. What are some, would you say, over-the-counter products that can relieve those symptoms?
So in terms of over-the-counter use for treatments of allergies, again, the over-the-counter decongestants, I wouldn't recommend for long-term use. Things that are safe for long-term use tend to be a nasal steroid spray, like Flonase, Nasacort, those different things that we hear about for commercials on TV. And then antihistamines are another option, Allegra, Zyrtec, Claritin, Benadryl, although Benadryl is a bit sedating compared to the others. Of the nasal steroid sprays, most of them are prescription. There is one that has now been approved for over-the-counter use. But generally, for most other brands, you need a prescription from the doctor. But like I said, there is one that's been approved for over-counter use. And then saline, again, is a very low risk way to kind of flush things out, especially when you have an exposure. So you've been in the park all day, exposed to tree pollens, and you're allergic to them. Using saline to just kind of flush out, the pollens in your nose is also a good idea to help alleviate some of the symptoms along with the medical therapy.
Mm. Well, and if someone's looking for something and they tell you they want to make sure that it's non-drowsy.
Yes.
What would you recommend?
So most of the second generation antihistamines are non-drowsy. Those include Zyrtec, Allegra, Claritin, all of which are in the antihistamine family. Of those 3 non-drowsy brand medications, Zyrtec has been shown to have some rare sedating effects, but again, it's rare. Most people tolerate Zyrtec fine. But any of those 3 or their generic versions are more than okay for non-drowsy use.
Because a lot of time people feel it, this allergy reaction or this allergy, constant sneezing, itchy eyes, and they want to go to work, but they want to take something and they don't want to be tired when they go to work.
Right, those tend to work great. Just a word about the antihistamines that have the D attached to their name, like Claritin D and Zyrtec D. Those medications do have a decongestant component in them along with the antihistamine. So what we said about the oral decongestants before, about prolonged use, I would also recommend taking that caution with the antihistamines with the D attached to the name.
So what would a patient that comes to your office expect from an ENT, ears, nose, throat, office visit?
So if you're coming to an ENT office with a complaint about your nose, chances are it's not a quick cold that went away, although sometimes it is. You would expect a thorough history asking about your symptoms. Some offices have things like questionnaires that you fill out about your sinus complaints and things like that. And after kind of, like we said, fleshing out your different nasal symptoms to kind of figure out which category you fit in, the doctor would do a physical exam. All right, and this is not your typical physical exam that you get at your internist's office. Basically, a lot of times what we'll do is we'll use some topical sprays to numb up the nose, okay? Let that sit for a few minutes, and after examining the rest of the head and neck region, we want to do something called a nasal endoscopy, okay? Sounds scary, but it's very simple, okay? Basically, what we do is after the nose is numbed up, we stick like a little camera that looks like a string of spaghetti into the nose in order to take a closer look. Now, this is a fiber optic endoscope. You see it has a tip that moves around to navigate, and it has a light at the end of it, okay? And it doesn't go all the way in, it just goes to the back of the nose.
So it goes up the nose?
Yes.
Okay.
This, in matter of a few seconds, can help us see a lot of nasal anatomy. It helps us to see if you have polyps, if you have pus draining out of your sinus outflow tracts. It helps us to see your anatomy in terms of your septum and things like that. So it can give us a lot of information about what's going on in your nose in a very short period. And we're talking a matter of seconds on each side. It's not this prolonged thing. The recovery from it is pretty uneventful.
So it's not painful, you would say? Or?
I would say you're going to feel a sensation of something up your nose, but it's not an excruciating, painful procedure. I was telling you earlier, I've had this done to me maybe 50 times for teaching purposes. It's really not that bad.
Okay.
Obviously if you're very congested or you have a lot going on, it's not as easy to put the scope in.
Right.
But for an experienced practitioner, this is not a painful thing to perform on a patient. Okay. But this is kind of the crux of what the specialist needs. How does it make him different from the internist looking up your nose? It's by using devices like this, and of course the greater expertise about the subject matter. So this is one of the main things that you'll see in an ENT's office used to examine the nose. And for children, we examine the adenoids in this way. We get a physical look at the adenoids. Like I said, it helps us to get an overview of the nasal anatomy during the visit. In addition to that, if allergy testing needs to be done, I showed you some devices we use in the office if the ENT does perform allergy testing in the office.
So the last thing I wanted to touch over was the term of a deviated septum.
Yes.
Which people may have heard it before, and I just want you to explain what exactly is this term of a deviated septum?
Sure. A deviated septum is something very common. I can tell you that probably about 80% of people have some deviation in their septum. Obviously not everybody needs surgery, right? We don't see 80% of people going for surgery for their septum. So let me just kind of show you on our model where the septum is and what we mean when we say deviated. So this is your nose, right? And in your nose you have two nostrils, okay? There is a piece of cartilage and bone that separates your two nostrils like a wall. Okay, and at the end of the wall, it opens up to one space again, all right? That wall is your septum, okay? If you see the pink over here in the model, you could see that's the area where the wall would be, dividing the two halves. When your septum is deviated, it means that that wall is not straight, it's bent, okay? And it could be bent to one side or both sides. It could be S-shaped almost like this, so it's blocking both sides. The question is, when you have a deviated septum, does it warrant to be fixed? And really, my policy in the office is, if it's working fine, it doesn't need to be fixed. So if you have a slight bend in your septum and you don't notice a difference in your breathing even when you exercise, or you have a little bend in the septum and you're congested but you're controlled with sprays, or other medications, you don't necessarily need to get surgery to fix it.
Okay.
However, if you're breathing with the medicine is not great, you notice a difference, or even a difference when you're exercising and it bothers you, and we see that there's an anatomic reason for that, being that the septum is bent, we can do a procedure to fix it.
Now, what causes this deviation of the septum? Are people born that way, or can they, as they mature and as your facial features start to develop, does it tend to bend over that way? What causes this deviation?
Most of the time it's congenital or genetic. You're born that way. We all have asymmetric faces. Nobody's face is completely symmetric. And as the face develops, the septum can bend to one side or another. And again, most of the time it's of no consequence, but if it is, it can be corrected. Other things that can cause a deviated septum is trauma. Okay, or even previous, nasal surgery where some sort of trauma to the nose happens and the septum can bend. Either way, the management is the same.
Now, as far as, I know you said if it's working fine, just leave it, and it doesn't have to be. As far as surgical procedures go, how does the procedure flow?
Okay, so fixing a deviated septum is a very routine surgery. Most people nowadays will do it under general anesthesia, although it can be done under local anesthesia. It is feasible. And basically what we do is we lift that mucosa or skin off both sides of that wall. We take out the part that's bent, taking care to preserve all the cosmetic support of the nose, and just basically lay that skin back down and sew up the incision. It's all done through the nose. Usually there is no outside cuts required. In terms of recovery, it's variable depending on the surgeon. Some surgeons use packing in the nose, some do not. But basically, I would say in my practice, it's about 3 to 4 days of a little bit of discomfort. Not a very painful procedure. It's not like you'll have black eyes, or anything like that. You don't need a cast on your nose like we see with other nasal procedures. 3 to 4 days of discomfort, but it's about 2 weeks of no heavy activity, exercise, lifting. Yeah, because it can, that's some of your healing time, and you don't want to induce a nosebleed after you've had the area operated on. So you don't want to do any straining for that period of time. But again, in terms of light activity or going to work, office work, things like that, that's usually doable within a 3 to 4 day period.
Thank you so much,
My
Dr.
pleasure.
Heidi. Pleasure to have you. Thank you for answering many of our questions. Thank you for giving us all the knowledge, supplying us with all the equipment, and we appreciate you taking the time to come and sit with us, and pray that God blesses your time and rewards you for all your efforts.
Thank you very much. Thank you again for having me.
We hope you enjoyed our episode today on our new season of CYC MD. We hope we answered many of your questions related to the topic of nose, in regards to sinuses, allergies, and the questions that you've also sent us from our last season. Until next time, have a blessed day.